All right. Well, now that I have a partner up here, reconvene the Executive and Legislative Committee's public hearing for Tuesday, February 7th, 2023. We have 3 items on today's agenda, all Senate resolutions for review, but we will get right to it unless my co-chair has any comments. Seeing none. So the first item on the agenda is the renomination of Deidre Gifford of Colchester to be Executive Director of the Office of Health and Strategy. Good morning. If you can raise your right hand, please. Do you promise, swear, and affirm to tell the truth, the whole truth, and nothing but the truth? Thank you. The floor is yours for any opening comments.
Thank you. Good morning, Senator Duff. And in case they are joining us remotely, Senator Looney, Representative Godfrey, Representative Yacarino, Senator Kelly, and other distinguished members of the Executive and Legislative Nominations Committee. As you heard, my name is Deidre Gifford, and for the record, I'm from West Hartford, not Colchester. And I appear before you this morning as Governor Lamont's nominee for Executive Director of the Office of Health Strategy. I'm honored by the governor's nomination and for this opportunity to present testimony to the committee today. I'm joined this morning by my husband and biggest fan, Dr. David Gifford. And with the indulgence of the chairs, if I might, I would like to dedicate my testimony this morning to my late father, William Spellacy. He left us in 2015, but it is his kindness, humility, empathy, and public spiritedness that are my guiding light in all that I do. He would be incredibly proud to see his daughter before you this morning, and so I appreciate the opportunity to recognize him. As you all know, I've spent the last several years in service to Governor Lamont and the state of Connecticut, first as Commissioner of Department of Social Services, beginning in June of 2019. And then from May of 2020 through September of 2021, I served as acting Commissioner of the Department of Public Health. Both roles have been among the most rewarding experiences of my career, and I really look forward to building on those 2 experiences in leading the Office of Health Strategy. As you're aware, OHS was created in 2018 in order to implement comprehensive data-driven strategies that promote equal access to high-quality healthcare, control costs, and ensure better health for the people of Connecticut. I'm very grateful to my predecessor in this role, Vicki Veltri, for all of her work in establishing and building the Office of Health Strategy, for laying the foundation for the work, and to members of the legislature for your vision in establishing OHS and for your bipartisan support over the years. In addition, I'd like to thank and recognize Ms. Kimberly Martone, who led the office over the last several months to ensure the vital work of OHS continued. The focus of everything we do at OHS is on improving health and healthcare for the residents of Connecticut. People want and need healthcare they can afford, that is accessible, and that results in the best possible outcomes given their circumstances. OHS has a number of critical tools at our disposal to advance this mission. For example, I'm excited to pick up the work of our Cost Growth Benchmark Initiative, and I'm grateful to the legislature for the bipartisan support that initiative received in the last legislative session. Our all-payer claims database will help us better understand what's driving the cost of healthcare and what our most effective solutions are likely to be. And all of our work engaging providers, employers, insurers, consumers, and others on primary care, health information technology, community health workers, health information exchange, and much more are part of the necessary comprehensive strategy to address healthcare cost and quality. I thank the committee for the opportunity to appear before you today. I appreciate your consideration of my nomination, and obviously happy to answer any questions you might have.
Thank you so much, and congratulations on your nomination, and thank you for everything you've done here in the States, specifically the last few years through some of the toughest times that we've had here in the state. So thank you for that. Can you describe just the mission of the Department of OHS? I know it's a fairly new department, and specifically how it interacts with other agencies, primarily the public health, Department of Public Health.
I'd be happy to. For administrative purposes, OHS does sit in the Department of Public Health, but that's for administrative purposes only. The statutory charge to the Office of Health Strategy is to develop and implement a comprehensive and cohesive healthcare vision for the state, including a coordinated state healthcare cost containment strategy, and also to promote quality healthcare and ensure access to cost-effective healthcare services. A very big job, but also a very important one. Your question, Representative, is really, I think, goes to the heart of one of the reasons I wanted to take this role, is that this is really addressing healthcare cost and quality takes all the parties involved to be rowing in the same direction. So at OHS, we work very closely with the Department of Social Services, the Department of Public Health on community health worker strategies and many other things, but also with the other human service agencies on initiatives and strategies to address both cost and equity and quality. It's really that kind of a comprehensive view that's the charge of OHS that's going to be necessary in order for us to really tackle the challenges that we're facing in healthcare.
There was a Connecticut Mirror article where you were quoted talking about the role of OHS leading, or the role around equity and OHS, and that you wanted to make sure that you really wanted to continue to focus on that work. Can you just talk a little bit about the importance of equity when it comes to the health disparities here?
Sure. So OHS has been given the very important charge of making sure that data are being collected around race, ethnicity, and language in a uniform and complete manner for all healthcare related agencies in the state. So that's a body of work that we've taken on. That is, to your earlier question, a body of work that requires us to be very closely aligned with the Department of Public Health, who obviously has huge responsibilities in terms of data collection, and they're also engaged in making sure that they're collecting data around equity. But we can't address health disparities if we don't accurately measure them. So we know some areas where we are not doing well in terms of disparities in health outcomes. Birth outcomes comes to mind. Life expectancy comes to mind. Outcomes for chronic disease come to mind. COVID-19 comes to mind. But if we aren't collecting the data that we need to understand what categories people fall into, we won't be able to address those disparities. So in all of our work in the Health Information Exchange, the All-Payer Claims Database, and all of our work with the carriers and insurers, we're striving to improve the quality of the data that we collect and collaborate across agencies to do that.
And on that point, on the Health Information Exchange, can you just give us an update on exactly where we are on that?
Yes, so we're making good progress. As you know, the statute around the Health Information Exchange, also known as CONI, requires providers to enroll or to begin the process of enrolling by March of this year, March or May of 2023. And so CONI has really been focused on getting the largest producers of data to be submitting. And they're making good progress on both hospitals and some of the other major networks submitting data to the exchange. They're also beginning to test some of the cases. For example, they're starting to test sending information out when a person is admitted or discharged or transferred from a hospital. And we heard at a recent event about hospital care managers that were using those data to understand when a patient that they were helping to care for had been admitted to the hospital and they potentially didn't know about it, so that they could follow up. We're also starting to work with our long-term care community, which is an area that's sort of been not as engaged in health information technology, but it's very critical that those doing home care and long-term care have access to up-to-date, for example, medication history. So CONI's putting a big focus on those sectors as well.
Thank you very much. I might have another question or two, but in the interest of time, I'll I'll defer to my co-chair, Senator Duff, for any questions. But again, congratulations. Look forward to working with you.
Thank you.
Chairman Duff.
Thank you, Mr. Chairman. And thank you all for your indulgence. It wasn't my intention to be as late as I was, and I apologize for keeping, if I kept anybody waiting, sincerely. Commissioner, I think I want to start off with saying how I think fortunate we are to have you working in our state. And I'm not saying that lightly or just to be complimentary, but I really do think that coming from where you came from, working in the federal government, you're a physician, you worked at UCLA, you've had lots of experience, and then helping us to manage through the pandemic really has been something extraordinary, having your steady hand through all those tough times. And I certainly appreciate the work you did through that time. And I think that leads to a lot of the things that what I see is you can do helping healthcare in Connecticut over the next 4 years. I think a lot of what we hear has to do with costs and managing those costs. And there's kind of the, two big elephants in the room, for lack of a better term, whether it's the, hospitals and hospital networks, insurance companies, you have physicians kind of in the middle of all that. And the consumer really doesn't have, their voices sometimes are lost because they don't know what's happening. They just know that either they're not feeling well, they are feeling well, or some procedure is going to cost a lot, or they can't get the procedure. Talk a little bit, if you can, about some of your work on coordinating some of that, or cost containment and health, strategies on that, because that, you think about a stress to the folks, whether it's in this state or any other state. And I think some of those things are what really is at the heart of so much angst with folks.
Thank you, Senator. And first of all, thank you for the kind words. And it really has been my honor to serve with this governor and with the team here in Connecticut, but I very much appreciate the sentiments. You, I think, alluded to, Senator, the complex nature of the healthcare system and why these issues of quality and costs are so challenging to tackle. I've been, pardon me, I've been at this work for a few decades now, and it seems, despite a lot of focus on improvements in quality and lowering costs, we're not making the kind of progress that we'd like to see. Last Friday, I was fortunate to be part of an informational session that we did with the Insurance Department, the Office of Health Advocate, and members of the legislature to talk about solutions to the high cost of healthcare and our challenges with access and quality. And we had local, regional, and national experts speak to us. And what they really focused on consistently was the need to come at this from multiple different directions, that there is no silver bullet that's going to solve all of our challenges in healthcare cost and quality. And we need to take a multi-pronged approach. And the other thing I think that came through strongly from that and from all of our work in Connecticut is that everybody needs to be part of the solution. And you've heard the governor say this recently at multiple events, is that we need health insurers to be our partners here. We need hospitals and hospital systems to be our partners. We need physicians. We need employers who are the purchasers of a lot of the health insurance. And to your point, we need consumers who can explain what the actual experience of care is like. Unfortunately, we're in a position now where between 40 and 50% of people are limiting their needed health care because of affordability issues. And that's just not a sustainable situation. That's going to lead to impacts in healthcare outcomes. And we're already starting to see declines in life expectancy, et cetera. We know that people are struggling to afford their medications. and the procedures and doctor visits that they need because of the out-of-pocket costs. So how do we tackle it? We could spend a couple hours talking about potential solutions, but the consensus appears to be what makes the United States stand out from other developed countries that have lower costs, almost half as much spending on healthcare as the United States, and better health outcomes. The difference really seems to be in price. That is what is charged by providers to insurers and others. So that's why I'm so excited to be at the Office of Health Strategy. We're starting to shine a light on some of those issues around cost transparency. Our all-payer claims database, as I mentioned, is an essential tool. And our benchmarking strategy is going to help people understand where the costs of healthcare are rising and where we need to focus our attention most.
Thank you. I appreciate that answer very much, because everything you said, I agree with, on the fact that, you know, the pricing and everything else, and we're seeing consolidation like crazy on all sides, whether it's on the insurance side, on the hospital side. We're seeing these huge healthcare networks, and physicians' offices being bought up by, you know, hospital networks. I'm not trying to make antagonists out of anybody, but these are the realities in which we are living in right now.
Right.
So if I have my primary doctor, maybe within Hartford Healthcare, it could be within Nuvance, because that's where the local hospital network is for me. But everything's all tied in together now. And I'm not sure that that's providing better cost containment for the consumer as much as it may be for the hospital, based on the way insurance companies or Medicare or Medicaid are charged for that. And there's probably good reasons why health networks want those changes. And then you have the insurance companies, and we've talked here about prior authorizations and other types of things that are really extremely important. That many consumers and doctors get very frustrated with at the same time, but insurance companies will argue that's to save costs. If Senator Looney were here, we'd probably talk about all the work we've done over the years in reform, surprise billing and other types of things, that when I look at some of the things that have or haven't been done on a federal level, I wish they would use some of the work that we've done on a bipartisan basis here in Connecticut as a model, because I think that would help to bring down costs, and we're so limited as to what we can do. So one, I'm going to tell you a quick story, and then two, I'm going to ask you another question. All I can say is that on the healthcare aspect of this, and the pricing, which you talked about, is so important, because when I was in my early 20s, I was playing roller hockey. I fell because I was playing too hard and too competitively on pavement. I messed up my face here and had to go to the emergency room. I didn't have health insurance at the time because it was pre-Obamacare, way pre-Obamacare. And it was too expensive. I just started doing real estate, and it was just too expensive. And going to the hospital and not having insurance, I saw firsthand the costs that were, because I went to the emergency room, the costs that were included in that, the double charging, the high costs, and the fact that I probably paid more as somebody who wasn't insured at the time than somebody who would have been insured. And then went through that bill line by line to see how much I'd been overcharged for things that I didn't even get. And then I, paid off my debt, obviously, but it's very hard for folks to do that. And I think that is a major problem. So, pricing, we talk about pricing for folks who are either uninsured or underinsured is a huge issue, and how, just like we saw in that New York Times expose about nonprofit hospitals and the money they're making, is something that we need to be concerned about. The other question I'll ask you, Commissioner, is when you talk about healthcare, health strategy, how much of that are you, I think a lot of times when we talk about health strategy, maybe the way this started off, because it started off as the exchange, but now, we're talking so much more now about mental health, and that's becoming hopefully more part of our health strategy. It's not just physical health, but mental health as well. How much is that a part of your office, or if it's not, is that something that is you're developing as a goal for the next 4 years?
You're talking about integration of mental health and physical health together, Senator. Really important point. And there is abundant evidence that individuals who are suffering with mental health challenges also have more utilization on the behavioral health, on the physical health side. So there's an interplay between mental and physical health, and it's important that they both be addressed holistically. We also know that sometimes an undiagnosed mental health condition can manifest itself with physical symptoms. So it's really important that our physical and mental health systems work side by side. Right now, the Office of Health Strategy has been charged with doing a study on payment and parity between commercial and Medicaid on the behavioral health side of things. Last session, when you all were doing so much work around mental health, there were a lot of questions that arose around what is commercial insurance covering, what it's not covering in mental health, what is Medicaid paying, and how does that compare to what's paid on the commercial side. So we're in the process of moving that study forward. I think that will be very helpful in advancing the conversation. We have 3 other main agencies that deal with mental health. Obviously, Department of Mental Health and Addiction Services on the adult side, DCF on the children's side, and then DSS, because their Medicaid is such a considerable payer for all behavioral health services. So it's important for all of us to collaborate. That's been one of the things that the governor has asked me in particular to work on, is when there are areas that go across multiple agencies, that we work on a coordinated strategy. I think there are multiple examples of us doing that. And I think the study that we're working on at OHS, along with the information we get in the all-payer claims database and the cost growth benchmark, will help sort of shine a light on the places where we need to collaborate further.
Great, thank you. And I appreciate everything you said and are doing. I won't belabor any more points because I think we're in good hands. And thank you for listening, and thank you for answering those questions and your vision over the next 4 years. It's very much appreciated. Thank you, Mr. Chairman.
Thank you, Senator.
Thank you, Senator Martin.
Thank you, Mr. Chair. Congratulations on your nomination.
Thank you.
I wasn't going to ask a question, but you piqued my curiosity here when you mentioned the US being the outlier in the world, that we are not the best in providing health care, and that our cost is the highest, or the rest of the world or parts of the world provide better outcomes at half the cost. Can you elaborate on that just a bit more? What are we doing wrong?
Senator, it's a really important question. We have a slide I'll be happy to share with you in follow-up that shows graphically in very stark kind of contrast where the US is on cost and quality compared to the other developed nations. It appears to be not utilization. So it's not that we're going to the doctor more. It's not that we're being admitted to the hospital more. It's not that we're using more drugs. It is that what we pay for each one of those services is substantially higher in the United States than it is in other developed countries. At the same time, we have a lot of social factors that are leading to our lower life expectancy. So issues like housing, transportation, nutrition, leading to factors like obesity, et cetera, that impact our longevity. Our health system is not good at addressing those social drivers of health. So while we're paying a lot for the services that we're getting, you could make an argument that some of that spending needs to be more focused on some of these social drivers that we don't always think about being directly related to health outcomes, but are really impacting the long-term health of our population. So, one of the things that we do at the Office of Health Strategies, for example, is look at how hospitals spend their community benefit dollars. So nonprofit hospitals are required by the IRS to spend a certain amount of funds on what's called community benefit in order to retain their nonprofit status. And much of that money can be spent on investments in these so-called social drivers of health. It's an important area for all of us to focus on. It's another, to Senator's earlier point, another really important place where a lot of agencies in the state government need to work together in order to address those things that are driving poor health outcomes.
So those social drivers, are they, I guess, is that what is happening in the other developed countries? Is that they are better at looking at the social drivers?
Well, I can tell you that there is a relationship between social spending and health spending that's inverse. So developed countries that tend to have higher levels of social spending, income supports, healthcare supports, childcare supports, those kinds of social spending. The countries that spend more there tend to spend less on healthcare and have better health outcomes. So that's a correlation that is that speaks to your point. Which is that there are a lot of there are a lot of things that we don't think about as being directly health related, but where investments can have a long-term impact on health. Things such as housing and transportation and nutrition are some of the most common ones.
So how long would it take? Should we start investing in those social drivers? I know it's a big ship, but how long would we see results?
It's a very good question, Senator. And I think one of the things that we've been talking about, again, across multiple agencies and with the governors and OPM's leadership, is investing in families with newborn children. So when you invest in things like universal nurse home visiting and housing supports, for example, for families with young children, you really start to see a broad array of improved outcomes in that one generation. So you start to see improved school readiness, for example, you see better academic achievement, you see better health outcomes overall, and less behavioral health challenges when you invest with families with young children. So one of the things that we're working on is we're going to be piloting in Bridgeport a universal nurse home visiting program paired with a community health worker program that will provide families that have risk factors with up to a year of support to help them not only with any kind of physical challenges that happen after the birth, but the community health worker will help connect them to resources in the community like food, transportation, housing, et cetera, that will help that young family get off to the best start. And there's very good evidence that $1 invested in a family with a young child reaps multiple dollars and that don't need to be spent later in life because of better outcomes.
And part of that discussion regarding families or investing in families, is there a discussion on the family institution and building the family institution? As you know, what I'm envisioning as you're speaking here is single families, single parent families. And I guess my question is, are there monies being appropriated to encouraging the dual parenting or shared parenting and family structures?
The universal home visiting program really focuses on building a support network for a family that's got a newborn. So you are correct that that having adequate supports for a new parent is really important. So the home visitor will assess whether the new parent has adequate supports, and if she doesn't, then help connect her to a network in the community, whether it's through the community health worker, the healthcare system, or the social service system, to connect to a social support system that will improve that family's outcomes.
How much of our population needs this help?
Well, one of the things about universal nurse home visiting is that it's universal. And there's very good evidence that having a universal program destigmatizes the act of offering support to a new family. We know for certain that people of all incomes, all race, all ethnicities can be in need after a child is born. It's a very challenging life transition. And so the universal nature of this program is one of the key elements of it. But the community health worker program that will follow on will be for those families that have a particular risk factor that's identified by the nurse home visitors. Since the program's just beginning to get piloted, we don't know exactly what percentage of families will either want to or will take advantage of that community health worker, but come back maybe in a year or so, we'll have data on what percentage of families are taking us up on that.
So going back to the social drivers and how long should we invest in putting money into those drivers? You mentioned if the family or supporting the family, what other things, what would be the next steps? And again, going back to when would we see these outcomes, positive outcomes?
So
Because the goal here is to drive down healthcare costs.
that's right. I think there's not a universal answer in terms of how soon you would see the results after investing in social drivers. Some of them are going to be long-term improvements. Maybe, investing in a young child, you see outcomes during that child's educational life, for example. But some of them will be immediate. So for example, remediation of home hazards in children with asthma. We know that certain children have worse asthma outbreaks because the physical environment in their home. And if we're able to address some of those physical environment challenges in their home, we immediately see, most importantly, that they feel better, they have better school attendance, but also that they use less healthcare services. When we as Human Services Commissioners got together and talked about if we had one thing that we could, one social driver that we could focus on, what would it be? Housing was what came up most often. So I think there's a pretty good consensus, not just in Connecticut, but around the country, that investments in housing have very significant payoffs when it comes to health and healthcare utilization.
I could go on with a ton of questions here because you touched on school attendance and how important that is for the health of that child. Let's go back, and I only got just maybe two more questions here. So we take out, I'm thinking of the other developed countries and their cost of cost of health. Are they using the hospitals and health services more or equally to the United States, or are we using it more?
So if you look at the list of developed nations, we're sort of in the middle or to the lower middle end on utilization. So we're not the country that uses the most health services, and we're not the country that uses the least. So that's clearly what's not driving us being an outlier when it comes to total medical expenditures. It really is the price that we pay for the goods and services in the healthcare system.
So with that, sounds like we're maybe, you said it's sort of in the middle. So if we take out all the direct costs of providing the service, then I've got to believe then it's the overhead of the facilities and the healthcare costs that are driving this.
Well, what's behind the prices we pay in healthcare it's obviously a really complicated question. The majority for putting drug prices aside, which is one major driver of healthcare costs, the majority of services on the commercial side, the prices are set by a negotiation between the insurer and the provider. And so, and there's been, sort of traditionally a lot of opacity in that process and not a lot of understanding about who was paying how much for what services. One of the strategies that not only Connecticut, but other states and the federal government are starting to adopt is to insert some transparency into that process so that at a minimum, we can understand how much is being paid for what services, what's the variation, and how much is a quote unquote appropriate price versus a price that might be excessive for a service or a good in healthcare.
Like I said, I could go on with more questions, but I am all set. Mr. Chair, thank you. Thank you, Commissioner.
Thank you.
Thank you, Senator. Any other questions or comments? As I look around the room, seeing none, let me just check our Zoom room to make sure that no hands are up, seeing none. We do have one final question, which is, we ask every nominee, is there anything in your past that you believe might prove embarrassing to this committee, to the governor, and to the state of Connecticut?
No, Representative.
Wonderful. Congratulations again. And
Thank
thanks
you.
for sticking with us this morning.
Thank you, and thanks to other members of the committee.
All right, moving right along. Second item on the agenda for today for the public hearing is item number 2. The reappointment of Charlene Russell Tucker of Guilford to be reappointed as a Commissioner of Education. Good morning, Commissioner.
Good morning.
If you can raise your right hand. Do you promise, swear, and affirm to tell the truth, the whole truth, and nothing but the truth?
I do.
Wonderful. Congratulations. And the floor is yours for any opening remarks.
Thank you very much and good morning. I know Senator Duff just had to leave the room. Representative Concepcion, Senator Looney, Representative Godfrey, Senator Kelly, Representative Yakarina, and members of the Executive and Legislative Nominations Committee. Good morning. I'm honored to appear before you today as Commissioner of Education for the state of Connecticut. Should I gain your support and that of the Senate for my renomination, it will be an honor to continue serving the students, the educators, and families of our state in this very important role. You have my detailed written testimony and my resume, so I will be brief. I am privileged to live in a state where education receives robust bipartisan support from the legislature year after year, and would like to thank each one of you and the entire General Assembly for your ongoing support of the students and educators of our state. I have served in various roles at the Department of Education for more than 30 years, and I'm profoundly dedicated and devoted to public service. From my start as an education consultant, I have served the department as a bureau chief, an associate commissioner, chief operating officer, deputy commissioner, and now I sit before you as the current commissioner. I very much look forward to continuing in this role to lead our K-12 education system on behalf of our diverse student body of 513,615 students, or over 100,000 school staff, and all families of Connecticut. A final word on our student body that I always value sharing. Of the 513,615 students in our state, 51%, or nearly 264,000, identify as students of color. 40.6%, or over 208,000, are students from low-income families. 16.7%, or over 85,000, are students with disabilities. 8.8%, or over 45,000, are students or English learners. That is the diversity of our Connecticut education landscape. Thank you for your attention, and I'm happy to answer any questions that you may have.
Thank you very much, Commissioner. Congratulations on your nomination, and thank you for all of the work that you and your staff have done over the last few years in some, as I mentioned before, in some really difficult times. Just starting with that, we're I don't want to say post-COVID, but we're kind of reeling of the situation and the effects of that COVID has had. Can you just give us a high level on where you think we are on that? What the impact COVID had on the education system of our children, and how we're hoping to mitigate and make sure that they're back up to level?
Thank you so much, Representative. And it's been a few years of challenges, as we all know. And we've certainly seen the impacts educationally on our students. We've assessed our students, and we recognize that there's some gaps that we need to be working very much to make sure that we're addressing and that we're mitigating. We are fortunate to have had the resources that we received from the federal government. We've had $1.7 billion in our state, over 3 buckets of funding. And we're really working very hard to make sure with our districts that those are invested in a way to mitigate those impacts. For example, we've got, as a department, we've actually we made sure that there were 5 investment priorities for the resources that we received. One of them was really looking at learning acceleration, enrichment, those kinds of things that we need to be working on academically. I am pleased to say that our district stepped up on that one and are investing over $700 million in that space. They've budgeted that for investment. social emotional, mental health supports. I know this is something that's important to you as well. That was also one of the areas that we've worked on. And our districts also have budgeted over $183 million in that space. The issue of working with families and community, another area of investment that is really important that we see our districts are working on as well. Looking at the safety of our buildings is another investment priority. And still looking at the digital divide and those kinds of things. And so those are things that we're also investing in and our districts are investing in. Smaller class sizes, tutoring for students. And I think that is what we have to work on and be really focused, provide focused attention to be able to address those needs for students.
I appreciate those comments, and I'm glad you mentioned mental health, because you're right. It's something that's near and dear and important to me. I'm a product of educators. My grandfather was a principal. My father was a teacher. My mother was a paraprofessional. My sister's a guidance counselor currently in East Hartford, and I personally see the stress and the impact that day-to-day employment as a teacher has. It's certainly rewarding, but it's also it takes a lot out of you. And I know you were focused a little bit on the student side of the mental health, but just curious on the teacher side. What are we doing on, and what what do you think the role of your department is to ensure that our teachers or paraprofessionals and everyone that touches the student body has the proper services to ensure that their mental health is right as well?
And so I thank you again for that question, because I always talk about our students and our staff because they have to be well in order to provide what it is that they're doing. And so that is a part of that work as well. And really working with our districts, and I've seen our districts working with their staff, with yoga and all those supports that they're providing. And some of you may have heard me talk about my big audacious goal around behavioral and mental health supports, and making sure all our buildings in the state have the requisite supports necessary, again, not just for students, but also for staff. And so that really is very important. We see investments locally of our districts, not just bringing in additional staff and supports, of course, but also making sure that their staff have access to other services as well. So that is really important. When we think about the entire ecosystem, education ecosystem, if we're focused on what's right for students, we have to be focused on what it takes for the adults in that system to be able to provide the services that's necessary.
Appreciate that too. I represent here the city of Hartford, and we've had issues when it comes to students being absent and tourism and stuff like that. And this was before COVID. We had issues. I can only imagine what the issues are. So are there any initiatives that your department is working on with local school systems to ensure that kids are back to school and they're making sure, I don't know if it's working with their parents or working with just the adults in their lives to ensure that they're going to school on a day-to-day basis?
And again, a great question, because that is so important. No matter what we provide in the education space, students must be present in order to access those supports and services. And so we've made it a priority, not only in collecting information throughout the pandemic to know where we are on a month-to-month basis for students, but to use that to inform the investments that we were making. We're really pleased. One particular program to highlight is the Learner Engagement and Attendance Program, the LEAP program, and some of you might have seen recent press release and information on that. I know Hartford is very much one of those districts that's really benefiting from home visitors. As I was listening to Commissioner Gifford just now talk about home visitors who are going into the homes and connecting with families to find out what are those needs, what are those drivers, what are those barriers that we need to address in order to ensure that our students can be in school and be in school regularly. So that is one. The governor made a $15 million investment. And then thank you to you all, the legislator came forward with funding in that space as well. So we can continue. 15 districts have benefited from the LEAP program. And we're certainly looking to make sure that we can invest even more. But attendance is critical. We recognize that as something that we must work on. So what are these barriers and how can we help to mitigate? And what can we do at the state agency level to support the districts in this space as well?
Was the LEAP program, was that funded through primarily ARPA dollars or?
Yes,
Okay.
so it started off with the governor's GEAR funding, so
Okay.
it's the COVID funding, and then from the legislatures, ARPA dollars.
So the,
supported.
I know the department received, I think you mentioned $1.7 billion worth of, kind of federal pandemic relief funds. A lot of the programs, they're one-time dollars, correct? So how do we ensure that the programs that are created using, these federal funds that we probably won't see again, will continue? Especially the successful ones, right? I mean, now we can see you using data and things of that nature of what is working, what is not, to ensure that the programs that are working, like the LEAP program, continue even after the federal monies dry out.
And that's really important to know what works. And we're really thrilled in our state that we're truly investing in knowing what works. We've also invested in a research collaborative, which we're one of the only states that's doing that, and has gotten national attention, where we are indeed evaluating the investments that we're making. And so we recognize that the LEAP program, for example, is one that is being effective. And so how do we, from a policy perspective, continue to share the outcome for that program so that we can talk to all of you about the funding and also for the resources that we have to make sure that we're using it in that space as well. So it really is important that we're investing in what works. I think that's what's going to help us both federally and here in our state to have the conversation about how do we continue to support those programs that are making a difference.
Yeah, I can't agree with you more. I mean, it's critical to ensure that we properly fund the ones that are working, and then really reevaluate the ones that might not be, at least at this time, working the way we're all hope they would work out. So I might have another question or two, but I just want to thank you and congratulate you on your renomination. I think you're doing some incredible work here in the state. And with that, I will open it up to any committee members here. Senator Martin.
Don't all stand up or raise your hands here. Congratulations, Commissioner.
Thank you,
I
Senator.
really enjoyed our conversation that we had a week or two ago. So I do have a few questions. So you mentioned attendance, how important that was. What can we do to address the poor attendance in various municipalities? Maybe if you could talk to that.
No, absolutely. What we're learning, Senator, from our LEAP program as home visitors are meeting families where they are. We do have, issues around health, for example. That is a part of the issue, trying to encourage families to make decisions, utilize, for example, our school nurses that may be there to help them support health issues that students may be having. And then, this school aversion, how do we make sure our students that had gotten used to maybe for the past couple of years, not having to get up every day, right, and go to school, get back into this regular attendance mode. And that is really important. So working with families as well to recognize the importance of school attendance, even at the younger ages, that being present really matters. And so working with families, working with community organizations as well that are in communities supporting families, really important for the messaging and the work that we have. And then when you go back into our schools, making sure that those are engaging places. Does the students, we find, and even from the literature and the research, that students, connect with a caring adult in their schools or having those around them. So it's really important that we're doing all those kinds of things to make sure that we can address student attendance across our state.
What is so different from 30 years ago to today regarding attendance? What percentage are we today compared to 40, 30 years ago? And what's changed so much?
Well, Senator, our environment, I believe, has truly changed in where families are and the struggles or challenges that may have. I see, for example, we recognize that mobility is an issue of concern. So stable housing, for example, and as students go back and forth, our families go back and forth, is an area that we also have to address as well. I think about what Commissioner Gifford was saying about the social structures or things that are around us. And so we have to be sure that we can address those issues as well and connecting families to the services that they need. That's just one area of things that I know may have changed. We also recognize that families, we have working families, or if we have single parents who may be working, what is happening in that space. We've learned that some of our students, older students, were out working to help to support the family. And so, so all of those issues, I do believe are impacting where we are today.
Yeah, I think one of the biggest things is you do have two parents that are absolutely working today in order to make ends meet compared to, 30, 40 years ago.
Yeah.
Whose responsibility is it to make sure that the child gets its, 8-10 hours sleep?
Well, a big part of that is in the home, right? For providing structures for students. We know that truly is important. So, we, again, being able to work with families to make sure that there's an understanding of what matters in that space is really important.
I'm sure that part of the lack of attendance is our children that don't get that sleep that's required to get up in the morning and go to school. How about homework? Whose responsibility is that to make sure that child does its homework?
Oh, same there as well. And that's why I believe some of our school districts sometimes try to help to mitigate some of those issues by providing after-school programs and programs that can help with students with homework and all of that. But that's why it is so important that school, family, community is really a nice structure when we talk about how to make sure students are finding success.
Yeah. How about minding the teachers?
And
How about whose responsibility is it to make sure that the child minds the teacher?
so you're talking about discipline and respect in that particular environment, and we know that comes in that space as well. We've recognized throughout the pandemic and the not being able to socialize as much in that environment. Our educators, have certainly experienced some challenges. There's been challenging behaviors that I know that they have to work through. But again, it takes, I believe, all of us working together in the entire ecosystem and structure to make sure that that information is being shared and that our students are providing the guidance as well.
Yeah. I bring up that last one particularly. My wife is a secretary for one of the local high schools in my district, and my daughter-in-law is a special ed teacher. So I hear some of what goes on in our schools, and it's really concerning that some of the things that are taking place, as well as some of the good things. So, how about maybe you and I had a good discussion about workforce development and our students and preparing them. Could you talk a little bit about where the state is heading under your leadership? We used to have a model of college curriculum. Everybody, in order to be successful, you need to go to college. And I think what we've realized in the last decade or so is that's not necessarily true. And not everyone is made for college. We encourage it. However, we are now having a really good conversation throughout the state regarding career paths and developing career paths, and maybe helping the student realize the God-given gifts that they've been given at an earlier age and through, middle school, through high school, and then perhaps on to college, or perhaps directly into a certificate program or right into the workforce. Can you speak a little bit to the vision that you have and where you think our state is going?
So thank you again, Senator. It's so important. We now talk about college and career, and not or career, which is really important. And this pathway programming is really important for our students. It helps to provide a focus for them. It actually can assist with attendance, that they've got something that they're connected to coming into school. We're a part of the Governor's Workforce Council, and that effort, working with the Office of Workforce Strategies, where we're aligning our collaborations to make sure that our schools across the state are able to offer those career pathways and programming for students so that they can connect, not just at high school, but even starting at the middle school years, to recognize and explore what are those industry credentials that they may be able to receive, or what is that career pathway that I'd like to follow. And so it is our goal to continue. We're deploying some of our COVID resources to help to support districts so they can amplify this kind of effort across our state. We have our CTE programs that are there that we're working on as well, and making sure that we have really robust offerings for all our students across the state. It is really important. It's what everyone's talking about right now, and we're very much in that space. How do you collaborate with the industry in your community to make sure that you can work very closely together to make sure students can have those opportunities very early on in their career to explore those careers and opportunities that are available to them. And it really is very important for us.
Great to hear. How about what percentage of the school districts are currently have developed a career path curriculum? And if it's 20%, is the goal to get to 100% throughout the state? What's that look like?
The goal is really to make sure that all our districts in the state are able to make those offerings available to our students in a very robust manner. So a part of the funding that we'll be providing is to make sure that we can help to scale, to find out where there may be gaps in opportunities or gaps in resources that's necessary. But that would be a matter of wherever our students are, that they're able to access those pathways in the schools that they're in. And so that really is the goal. One of the wonderful things I think we're able to do is to bring our districts together so that they can share what it is that they're doing. So again, and if we at the state are able to provide the structure that can then be utilized by the districts, right, for where they are, I think that is would get us really moving forward in a really constructive manner.
I agree that rubric is important. I think that's, in our conversation, you know that I've been talking to various stakeholders throughout the state regarding workforce development. And one of the things that we heard was developing this system in order for everybody in the state, school districts, that is, in order to adapt the system to develop a career path. So I'm glad that you guys are working on that. I have no other questions. Thank you, Commissioner, and
Thank
I
you.
look forward to seeing these changes. Thank you.
Perfect. Thank you.
Thank you, Senator. We do have one question from, or one hand up, I should say, virtually from Representative Quinn.
Thank you, Mr. Chairman. And again, Commissioner, congratulations on your renomination. Like Senator Martin, I thoroughly enjoyed our conversation. And, you've just touched on some of the things that Department of Education is doing in trying to assist students who may not go to college. Is there anything else you want to add to that? I mean, that's one of my biggest concerns, is that we're doing a great job of educating our students, but so many of them get to graduation day and just aren't ready for quote unquote real life after that. So what other initiatives, what can we do in the legislature to help you to make that a reality?
So thank you, and great to see you, Representative. We will be certainly providing a report to you all very soon about what barriers we may need to address as we're talking to our districts to find out what barriers may be there. And then that would certainly be helpful to the extent that any of those barriers may have a legislative solution for us to be able to do that in that space. And I'll draw your attention to our career, technical education and career system, CTEX, and the work that they do there. And I tell you, it is really heartwarming to understand that we have students who, before they graduate high school, right, they're interviewing and they're going on to jobs. Some of those opportunities then pay for higher education for them. And so those are the kinds of successes that we'd like to see replicated, where students have access, an equity of access across the board to understand what's available for them that they can tap into. As I said earlier, I do believe it helps them to just stay connected academically, and the world belongs to them, after doing that. And so being able to provide those opportunities, I believe, is something that we can, working with our partners, amplify in our state, and it can become a reality for our students.
Thank you. And again, congratulations on your renomination. I look forward to supporting you, and I just admire you and your enthusiasm for the job.
Thank you very much.
You're welcome.
Thank you, Representative. Any other questions or comments for the commissioner? Seeing none, Commissioner, I do have one last question. Before you go, is there anything in your past that you believe might prove embarrassing to this committee, to the governor, to the state of Connecticut?
No.
Thank you very much. Congratulations. Again, I think we're all looking forward to working with you.
Thank you very much.
All right, and moving on, the last item on the agenda today, again, another Senate resolution, is the reappointment of Jorge Perez of Cheshire to be appointed as a Commissioner of Banking. Good morning, sir.
Good morning, Mr. Chairman.
Oh, yeah, we got plenty of time now. Yeah. If you can raise your right hand, please. Do you promise, swear, and affirm to tell the truth, the whole truth, and nothing but the truth?
Yes, I do.
Wonderful. The floor is yours for any opening comments.
First of all, I want to apologize for the hoarseness of my voice, but I had a medical procedure that has impacted my vocal cords, but the doctor tells me in 3 months I should be fine. Senator Duff, Representative Concepcion, Senator Looney, Representative Godfrey, Senator Kelly, Representatives Yacarino, and honorable members of the Executive and Legislative Nominating Committee. My name is Jorge Perez. I realize that some of them are not here, but they're joining us electronically. And I'm here honored that Governor Lamont has reappointed me as Commissioner of the Department of Banking, contingent on your consent. The Connecticut Department of Banking is the primary state regulator for state charter banks, credit unions, securities, and consumer credit, which includes mortgage companies, money transmitters, student loan servicers, and other industries. Its mission is to protect users of financial services from unlawful or improper practices by ensuring regulated entities and individuals adhere to state banking, consumer credit, and security laws. We accomplish this through regular, thorough, and cost-effective examinations of entities we supervise. We also engage the public and other stakeholders in a variety of ways, including direct educational and other outreach initiatives. When I became commissioner 8 years ago, there were some issues that I needed to address. One of them was the efficiencies in the department. I learned about this concept that the state had called lean, and the private industry, we used to call it re-engineering, which is very similar, simplified. And under the umbrella of the state lean initiative, we designated a program and a strategy to how to improve the efficiencies in the department. And I'm very proud and very glad to go over very quickly some of the things we've done. We modernized our system and process by implementing the state enterprise system called e-license. Before that, we used to depend on access base. And if that system ever failed, we would lose all of our cases that we're working on and so forth. This is a tremendous improvement. Partnered with the Capital Community College in 2018 to develop a cybersecurity training program specifically designed to the department. We could not find any training program, so we, working with the community college system, we developed one, which is now they're offering as an associate degree. Being accredited in banks and credit unions and achieve accreditation for mortgage banking for the first time in the history of the agency after failing several times trying to achieve that goal. Began to develop a financial empowerment program designed to help women and girls in the hands of other financial literacy efforts, enhancement of other efforts. Collaborated with other stakeholders to host a series of networking events focused on connecting minority and owned business and other small businesses with local bankers. Develop a process to create individual development plans for our employees interested in advancing their careers or simply improving the skills. We knew that we were going to have a big retirement age because group of people, because when I started, the average age of people working in the department was 38 years. People work there, don't quit. Increased enforcement, especially in the areas of elder fraud, mortgage forbearance, fraud schemes, and security fraud. As we emerge from the pandemic, I'm excited about a new initiative we are undertaking to help ensure that all residents have the same opportunities and access to capital and other financial services. We plan to bolster capacity within the department to give increased focus on Community Reinvestment Act and other fair lending practices. This will ensure that entities subject to our supervision are serving the entire community where they do business. It has been an honor of my life to serve as banking commissioner. Should I be confirmed, I will continue to ensure that the Department of Banking serves the people of Connecticut and it meets its mission of protecting Connecticut consumers and investors by ensuring that safety and soundness of the institutions we supervise, along with their adherence to Connecticut banking, consumer credit, and security laws. Thank you for this opportunity to talk to you, and I'm available for any questions you may.
Thank you very much, Commissioner. Congratulations on your nomination. Just a couple questions. I know you've been commissioner for 8 years, and what do you think your biggest accomplishment has been in the department? I know you mentioned the e-license implementation, which I think is an important piece to that. Are there other ones, other accomplishments you want to highlight?
Yes, I mean, being able to, what we call in the regulatory business, having a trifecta, meaning being nationally accredited in banking, credit unions, and mortgage company is a great honor, not only from a prestigious perspective, but that means that you have well-trained people, knowledgeable people, and it reduces the burden on the industry because now we can do joint examinations with the federal regulators and actually even take their place. There have been times where we've done the examination and they use our examination as theirs. And there are times where we use their examination as ours. And we tend to, as much often as we can, to do it jointly. So you don't come, like for instance, the state comes in, spends 3 months there. We never spend 3 months anywhere, 3 weeks. And then the federal comes in and spends another 3 weeks. So we try to do it all at the same time to reduce. So, and still hold the entities accountable, but do it more efficient, more cost effective. I mean, the work we do is not as glamorous as the other two because we're mostly accountants, right? And it's mostly about numbers and do you go to the step light to the red light or not? To use that analogy. Also, developing staff. I'm a firm believer that you should help your staff progress. So that's why we came out with this idea of the individual development plan. It's voluntary. We cannot force our employees to participate on it unless it's directly related to a job or a duty that they're doing. Most of our employees are taking us up on it. It also helped with any issues we had with performance. So instead of running people out because they cannot write examinations or didn't get something, we will give them additional help if the employees so desire. And it was an easy system where we would not use anything that went through that process against you in your review. But if there was an improvement, an improvement need, and you didn't participate, obviously that will reflect in your review.
And
also,
then-
that thing we did with the small businesses.
Yep.
And making sure that people felt the banking was accessible to them, whether it was through Bank On, whether it was through some of the financial literacy we're doing, or Meet the Bankers. It has been extremely successful. I'm very proud of that, and we got some tremendous feedback on that from businesses, consumers, average people.
It's great. I appreciate those comments. I was interested in the what you mentioned about the cybersecurity and the relationship with Capital Community College. Can you just expand a little bit on that? Does that mean that anybody that works for the department has to go through the training program that was created by Capital?
There's 3 phases in that program. The first phase, everybody has to go through. Myself, the secretary, my office clerk, my materials person that handles the mail and so forth, right? And that's everything from this is the computer, and how networks are set up, entry level, phishing email, cyber attacks, So basic knowledge for everybody. And the second one is all examiners, because those are the ones that are going to go to the banks, right, and do examinations. So how can we examine to make sure that banks or credit unions or mortgage companies, security companies, so I'm going to primarily mention banks, but I mean the whole industry we regulate. If they tell us that they are patching the computers, how can we test for that, right? If they're telling us that changing passwords, how do we test for that? Are they keeping their logs, right? So in case there's a problem, what's the training they're doing for the employees? So that's the second phase. Then the third phase are now become subject experts. So that's everything they learned so far, but much more in depth. And those are people that would become almost like mini experts in examination, auditing of IT stuff. Also nationally, I sit in the board of CSBS, which is the Conference of State Bank Supervisors. And we're partners with other federal agencies there, including FinCEN, who came out with a template that entities can use to check off a whole bunch of things they can do to make sure that they have a good system in place, right? And we also go and test their recovery plans. We test the training programs. When we do the examinations, we look to make sure that they have a system in place where they're going to check for people not walking out of the desk and leaving the computer open, sharing passwords, stuff like that.
That's great. And one other at least question for now is, again, I represent here in Hartford, and we talk a lot about food deserts here in the city, and ability for a lot of our residents to be close to fresh food and things of that nature. There's something to be said on kind of banking deserts as well, and financial deserts, of where some of our residents don't have the accessibility to a banking institution close to their home. Is there any data or anything that your department has or is working on to try to improve the quality and the equity when it comes to having certain banks in certain pockets of urban areas?
The law does not allow us to force banks to open up branches or people, investors, to decide that they're going to open up a new financial institution, right? But what the law does gives me some discretion is when they want to expand, right? Unfortunately, the way that the law is set up is, if a financial institution wants to expand, they need my approval, right? And they go through a full-blown process, right? But if they want to close a branch, all they have to do is give me notice. I'm not the legislator. I mean, pass the law. I could tell you the industry when I want you to change that law, right? But I think there's a place there that we can look at. Because that's really what hurts more, right? So for instance, when there are mergers and acquisition, there was one that not the primary regulator, but I was involved in it because there's a state law that says if an out-of-state bank is going to take over a bank that's headquarters in Connecticut, whether it's federal or state, and as a holding company, I have a role to play on that. And it's really more ceremonial than anything else, because we don't decide the plan for the merger. The primary regulator does that, right? But in this particular instance, they were going to close. They already had, prior to the merger, that entity that was being taken over already had announced that they were going to close approximately 80 branches. Many of those branches, and that's not a state charter bank, was not a state charter bank. Many of those branches were in low to moderate income areas, including Hartford, including Birchburg. I can assure you that all those branches were not closed. Every single of those branches were open. In some cases, they were closing because they were losing their lease because it was in Stop and Shops. I convinced them that there were other facilities nearby, still within walking distance of those customers. So yes, we do have data that could tell us in a particular assessment area, census data, how many people there are low to moderate income, right? How many people may have a car, not have a car? How many people, you could extrapolate how many people are walking to those facilities because they don't, or using public transportation. And using some of those data, we do encourage, like in this case, that it requires some approval from us. And we got the cooperation, very willing cooperation to address that. And some of the branches that they had publicly stated they were going to close, even after the merger, did not end up closing.
Commissioner, I might have another question or two, but I will open it up to the rest of my committee members here. Any questions or comments? Senator Martin.
Thank you, Mr. Chair. Congratulations, Commissioner.
Thank you.
I meant to ask Commissioner Russell Tucker, but this sort of ties in with you a little bit. Have you had any discussions with the State Department of Education regarding the importance of financial literacy in our schools and requiring our schools to teach financial literacy?
Yes, I've had discussions, not necessarily at times at the commission, but mostly with lower levels staff underneath that handle this for her. In fact, at one point, the department, prior to my time, but there's still funding there, so I am part of it, but this was not something I created. Back in the day, in the 2009, 2010, when we had the big mortgage crisis, some of those settlements created a fund, almost $8 million, that the department orchestrated to go to the education department for literacy education. Recently, there's still about 800,000 or so, 700 and change left in that. So we do interact with each other on that. I have several times discussed with all my colleagues, all my commissions, not only education, but Department of Transportation, Department of Corrections. Because yesterday I was just having a conversation with the commissioner of Department of Corrections and the National Guard about us coming in and doing a seminar for their employees, or in the case of Department of Correction, even the inmates, about banking, the bank account, about securities, about bonds, whatever the topic may be, depending on the audience or what people were interested in. So to answer your question, I have never told them that they have to require it because that's not my role, right? I encourage that literacy education is a must. I personally do it myself sometimes. I've gone to high schools, colleges, businesses, banks, credit unions that I regulate and that I don't regulate. We've done it in the libraries, we've done it in senior centers.
Yeah.
And definitely we've done a lot of high schools and
Yeah.
in fact, in several of our financial institutions have branches in schools. Not many, but it's like 4 or 5 of them. And we teach the kids to do everything from under, adult supervision, obviously, take deposits, process the savings book, which they don't assist anymore per se, but in those
Right.
cases they do. And they play manager, the role of manager, they play the role of the teller under, proper supervision.
I bring it up because, since we are moving towards these career paths and we're hoping to teach our children that when they leave high school, that they either are going to go on to college or they're going to work. And most of them are not going to be living with mom and dad anymore, or if so, it probably will be for a very short amount of time. But learning the basics of how much it costs for a credit card, learning how to balance a checkbook, in my opinion, are critical life skills that need to be taught. And I'm really sorry that I thought a bit, didn't write it down, but I really wanted to ask Commissioner Russell Tucker her thoughts on making that part of the overall curriculum for career paths. And I was just curious to see if you had any role in the encouragement of that. So that's why I asked the question.
Staff and encouragement, we do, and we have taken that role.
Yeah. Good. Going on to, I was on the banking committee for, I think, 4 years, my first 2 terms. And I know that this came up regularly and the sunset date kept moving. And it's regarding the foreclosure mediation program that we have currently. And it's currently set at 2029 to sunset. There, at the time that I was on there, we're just coming out of the 2008 Great Recession, and we had all sorts of foreclosures taking place. And those numbers had, I think by the time I left the committee, that those numbers were lower. Those that are going through the program or going through a foreclosure were less than when the program got initiated. Can you speak to that and where do you think this program is headed? Um, uh,
From a regulatory perspective, and I would think, and I'm not speaking for the banks, but I'm going to sound like I'm speaking for the banks and the credit unions and the services that do this. This has become a routine for them now. It's become part of what they do every day, right? And it's part of the structure, it's part of the culture, to work with the customers and to try to prevent foreclosure as much as you can. And in the last 2 years, with all the money that's been come from the federal government, has made that even easier, right? Because there's been a lot of different efforts to help people catch up if they fell behind. So I think the program is working out great. I don't think people think of it anymore as a mandate per se, as part of what should have been happening, and it's definitely part of what's happening. When we do our regular our truth in lending, when we do our CRA, we specifically look at the institution's effort to minimize foreclosures, right? And to mitigate foreclosures. I mean, unfortunately, there's still going to be some that happens because bad things happen to good people, right? But we look and we take into account the efforts that those institutions are doing to make sure that they did everything they could. Sometimes what you need is a little extension of the payment. Sometimes
Sure.
you need to lower the interest rate, whatever the situation is. Sometimes people lose their job for a period of time, 3 or 4 months, and then they can catch up.
Yeah.
So all that stuff now has really become as much as when you go to a bank, ask for an ID.
So the institutions are doing that. And if I understand, my memory serves me right, they may have been doing that back then, but this program here, they got another crack at it, so to speak, right? So what makes you think that if they couldn't go through it with the institution, that they're going to be successful with this program?
I want to add something because we still get some complaints about foreclosures, not really recently because of what's happened with COVID, right? And all the help that's got. But those are not state charter banks for the most part. Those are the larger banks that we don't regulate, right? That are so big that I like to say they're too big to succeed, not to fail, right? I mean, I don't think what I've seen personally since I've been the commissioner, right? And I was a banker myself in the past, right? The banks don't want to get paid back with bricks and mortars, right? They want to get paid back with cash, right? Because they don't want to be real estate agents. I mean, that's anybody who tells you a financial institution wants to be a real estate agent don't understand the financial network and doesn't understand what the mission is. So some might have needed help to understand that that's a win-win for both. But remember, the entities that I regulate, I tend to be community entities, right? They're not the large institutions. They are your local shop that's been there, your local bank or credit union has been there for 100 years, 125 years, right? They may have 20 branches. I mean, my biggest institution has like 58, right? The large institutions that I don't regulate, the federally charter, I mean, they have thousands, right? So those entities, in my opinion, always got it, right? Always were doing it. Did the forbearance programs that the legislators came out with some input from the department help? Yes, because even if you don't regulate those entities, to the power of group pressure, reputational risk, some of the bigger institutions that we don't regulate picked up on it and also did it, right? And once in a while, even the smaller, the true community banks sometimes do need to be reminded,
Okay. Regarding the passage of the cannabis, how are those establishments allowed to do banking here in the state of Connecticut, given the fact that on the federal level it's still not legal?
So the legal answer is illegal to bank, cannabis money at the federal level. However, the U.S. attorney, the former attorney called Call, came out with the Call memo, which basically acknowledges that it's still illegal to do that at a federal level. But if a financial institution decides to quote unquote bank and cannabis money, there's a set of rules that if you follow, at least from the U.S. attorney, they're not going to prosecute, and they're going to direct all the U.S. attorneys in the states not to prosecute, right? And that started out in, I think it was in the Clinton, and then it went to George, the Bush, then Obama. Trump also followed the same rule, even though his U.S. attorney didn't reconfirm the memo, but he says he's going to live to the spirit of the memo, right? So in essence, it had the same impact. Under the current Biden administration, same thing. Everybody's following the Cole memo, right? So FinCEN, who's the primary federal regulator that worries about money laundering, and we all do, but that's the main, one of the main mention, would not go after any financial institution as long as you're following the Cole memo. We don't go after any financial institution as long as you're following the Cole memo, right? Because in Connecticut, cannabis banking is legal, right? So it's up to each individual institution if they want to take the risk that if the federal government decides to enforce federal law, and it depends who's the U.S. attorney, I guess, or the president, but it's really the U.S. attorney because they're somewhat independent. If they decide to enforce it, they better have a good asset strategy because it is technically a criminal activity.
Are you planning on monitoring those guidelines?
Yes, when we go and do a safety and soundness examinations, we look for accounts, right? If we see any accounts that appear to be banking cannabis and bank money, we do extra work and know your customer, meaning we make sure that the Cole memo is being followed.
So the federal guidelines will be
Yes.
followed. So, and
Yeah.
you do that with your normal, would that be part of your normal auditing?
Yes, yes. Unlike others entities, when it comes to a bank or credit union, we're required to examine them technically every 12 months, right? That changed about 3 years ago, that if the CAMELs, meaning the ratings are really good, we could, with the consent of the institution, it's a choice by them, we could do it every 18 months, right? Unlike other entities, like there's some mortgage company that until recently we haven't examining for 8 years or 10 years, right? Because there's no law that says you got to do it every 2-3 years, right? So it's depending on staff, training, and so forth. Now we're much better, right? When I got there, we were averaging about 5 a year. We're now doing like 50, right? In that area. Same thing with the securities, right? There's no set number that says every year you got to do X amount of number. Unlike banks and credit unions, this is the federal law that says you must do it every 12 months, which then got changed to 18 months.
So you mandated to report if they don't meet all those established federal guidelines?
Oh, we will enforce it. Yes.
You would, so you're the enforcer
Yeah, because that's their charter.
with a notice to the federal
Yes,
government?
yes,
Okay.
yes.
All right, I
We
have no,
will have to communicate with the Department of Justice.
okay. Thank you, Commissioner. Thank you, Mr. Chair.
Thank you, Senator. Any other questions or comments from committee members? I see none online, so I have one last question, Commissioner. Before you go, is there anything in your past you believe might prove embarrassing to this committee, to the governor, to the state of Connecticut?
Not that I'm aware of.
All right, well, congratulations.
Thank you.
All right, I believe we have a couple of individuals that have signed up for public hearing. I don't think they're here. The first one, I don't think I see them online either. Kate Diaz. Ryan Friedman. And John DeLorio. All right, well, with that, I will close end the public hearing portion of the committee meeting. And we will await Senator Duff. Are you good, Wendy?
Yep.
All right. Well, with that, I'll officially call the Executive and Legislative Nominations Committee for Tuesday, February 17th, 2023 to order. We have 3 items on the agenda, all Senate resolutions. First item on the agenda is the nomination of Deidre Gifford of West Hartford to be Executive Director of the Office of Health Strategy. Is there a motion? Motion made by Senator Kelly, seconded by Senator Martin. Any discussion? Seeing none? Madam Clerk?
Senator Duff, Senator Looney, Senator Kelly,
Yes.
Senator Fonfara, Senator Hartley, Senator Kushner, Senator Martin, Senator Moore.
Yes.
Oh, you're there. Sorry about that. Senator Moore,
Yes.
Senator Summers. That's it, sir.
Thank you, Madam Clerk, and we will leave votes open till 4 o'clock today. Second item on the agenda is the reappointment of Charlene, another Senate resolution. The reappointment of Charlene Russell Tucker of Guilford to be reappointed as a Commissioner of Education. Is there a motion?
Motion.
Motion made by Senator Kelly. Is there a second?
Second.
Second by Senator Moore. Any discussion? Seeing none, Madam Clerk?
Senator Duff, Senator Looney, Senator Kelly,
Yes.
Senator Fonfara, Senator Hartley, Senator Kushner, Senator Martin, Senator Moore,
Yes.
Senator Summers.
Thank you, Madam Clerk. Last item on the agenda is the reappointment of Jorge Perez of Cheshire to be appointed as a Commissioner of Banking. Is there a motion? Motion made by Senator Kelly, seconded by Senator Martin. Any discussion? Seeing none, Madam Clerk, please call the roll.
Senator Duff, Senator Looney, Senator Kelly, Senator Fonfara, Senator Hartley, Senator Kushner, Senator Martin, Senator Moore,
Yes.
Senator Summers.
Thank you, Madam Clerk. And with that, that is the end of our business, but we will recess till 4 o'clock. I do, for notation purposes, wanted to comment that Representative Yacarino did miss today due to a death in his family. So our thoughts and prayers are there to the good representative. But with that, we will stand in recess till 4 o'clock.
Hi, Senator Hartley. Oh, I can't hear you. You're muted.
Hi, Wendy.
Hi, Wendy just ran out for a minute, but she'll be back soon.
Okay, can you take my vote?
I'm not sure if I'm allowed to do that, to be quite honest.
Okay, because I have a very limited window. Can you,
Okay.
can you text her and tell her?
Yeah.
Okay, that'd be helpful.
Mm.
Hello, Lindsay?
Hi, I texted Wendy, so I'm sure she'll be on her way back soon.
I'm sorry, she's probably trying to get herself some lunch or something.
I'm not sure. I think she ran up to get something.
Okay. All right, I just don't want to, how many votes, how many Senate votes are there?
There's 3.
Yeah, are they all Senate votes? Were there any? It's
Yeah,
correct.
they were all
It's
they were
Gifford.
all Senate today. Yeah,
Hmm.
Gifford, Russell Tucker, and Perez.
Okay. I don't mean to be a pest.
No, of course. Sorry, she ran out. I'm honestly I'm not sure if I'm allowed to take her vote, or else I would.
Yeah, I'm gonna text her too and ask her. Here we go.
She says she's on her way back.
Oh, okay. Oh, I feel terrible.
Oh, no, you're fine.
It was a quicker hearing today, huh?
Yeah, surprisingly. Yeah.
Hi, Senator Hartley.
Hey,
I
hey,
can't,
Wendy, hold on.
I can't see you and my video's weird.
Yeah, you got some kind of blurred thing going on here. Hold on a minute. Let me put my camera on. Do you see?
I can't see you, but you can't see me, but I can see you.
Oh, okay. So is that all we need?
Can you hear me?
Yep, I can hear you. Yep.
Just give me thumbs up or thumbs down.
Okay.
Different?
Senator Hartley, the affirmative. Thumbs up.
I can hear you. Now I
Okay.
can hear you. And
Okay.
Charlene Russell Tucker
Senator Hartley in the affirmative.
and Jorge Perez for banking.
Is Senator Hartley in the affirmative.
Okay, you're all set.
Thanks so much, Wendy. I didn't mean to be a pest. My apologies.
Anytime.
Okay, take care. Bye-bye.
Bye-bye. Rep. Perillo, I'll just mark that you were here. There's nothing for House members to vote on.
Thanks, I appreciate that, Wendy.
Oh, I can't hear you. Hang on. Not this again.
I'll give you a thumbs up.
Okay, I got it. Got your thumbs up. But I marked you here, so. Senator Duff, if you're on, I can take your votes. Commissioner Barnoni.
Yes.
I will just mark you down that you were there because there's nothing for you to vote on.
Oh,
All
thank
set.
you.
But you'll have attendance anyway.
Okay. Have a great day.
Thank you, you too.
Bye-bye.
Bye. That's,
Good, thanks.
and so Hubert Gifford, Executive Director of the Office of Health Strategy.
Senator Looney votes yes.
Darlene Russell Tucker Guilford to be appointed as Commissioner of Education.
Senator Looney votes yes.
And Jorge Perez, Commissioner to be appointed as Commissioner.
Senator Looney votes yes.
Thank you.
Thank you, Wendy. That's great. So that was it. They're all done.
I'll sign it. Deirdre Gifford to be appointed as Executive Director of the Office of Health Strategy. Riley Russell Tucker, Education, and Jorge Perez for banking. All righty. Gonna say hi to the moderation. Hi, Senator. Just one sec. Now I just have to find the sheet so I can take your vote. Okay.
No problem. I'm not going anywhere.
Okay. Deirdre Gifford for Executive Director of the Office of Health Strategy.
Summers votes yes.
Darlene Russell Tucker to be reappointed as Commissioner of Education.
Summers votes no.
Jorge Perez to be reappointed as Commissioner of Banking.
Summers votes yes.
That's it. Thank you so much.
Thank you. Bye-bye.
Can you tell me the number? Okay, that's good. So I'm just gonna stop it now. Oops, I think.